not a minute, hour, day, or night that I don't love you. You're at the top of my list, cause I'm always thinking of you. I still remember in the days when I was scared to touch you, how I spent my day dreaming, planning how to say I love you. You must have known that I had feelings deep enough to swim in. That's when you opened up your heart and you told me to come in. Oh, my love, 1,000 kisses from you is never too much. I just don't wanna stop. Oh, my love, a million days in your arms is never too much. I just don't wanna stop. Too much, never too much, never too much, never too much. Woke up today, looked at your picture just to get me started. I called you up, but you weren't there, and I was broken hearted. Hung up the phone, can't be too late, the boss is so demanding. Opened the door up, and to my surprise, there you were standing. Who needs to go to work to hustle for another dollar? I'd rather be with you, cause you make my heart scream and holler. Love is a gamble, and I'm so glad that I am winning. We've come a long way, and yet this is only the beginning. Oh, my love, 1,000 kisses from you is never too much. I just don't wanna stop. Oh, my love, a million days in your arms is never too much. And I just don't wanna stop. Oh,
Welcome to Virtual Learning Circles. Thank you so much, Kim and Mega, for joining us today. Virtual Learning Circles are a place for leaders in community service, policy, philanthropy, and research to come together to talk about issues related to early childhood and really think about how we can all work together for social change and the well-being of families in Southwestern Pennsylvania. So thank you both for being here. And I also want to thank the wonderful team that is behind all of this programming every month. So Marcus Sabs, Suzanne Morris, and Gabby Durden, thank you so much. And we recently onboarded a content and engagement consultant, Dr. Cassandra Brentley, who will also be supporting the work at the Early Childhood Funders Alliance of Southwestern Pennsylvania. So thank you all for being here. In today's conversation, we are going to talk more about increasing family economic security. It was something that we talked a bit about last month, and we wanted to dive deeper and really have two experts who have launched programs that are really focused on ensuring the advancement of economic mobility for families in a really innovative way. And so, Mega, I had talked to you a little while ago and was really just very intrigued by the work that you're doing at Monarch Foundation. And Kim, you were wonderful during our Investment Advisory Council work. And so we thought it would be great to have you join us today. So before we jump into our conversation, I do want to give the audience a proper introduction to both of you. And I'd like to start with Mega Ardwal. She is the executive director at the Monarch Foundation. She oversees foundation operations in all portfolios, including the Monarch's pregnancy and early childhood grant-making portfolio. Mega is also the co-founder and executive director of the Bridge Project, which is New York City's first guaranteed income program. It was designed to support new low-income mothers with unconditional cash during the first 1,000 days of their babies' lives. Mega graduated from the University of Pennsylvania and is a current member of the South Asian Ladies Unite to Empower, also known as Salute. And next we have Kim Eckel, who is the CEO of Footbridge for Families and founded the organization in order to fill a much needed gap and our society's safety net. Kim has been the manager of strategic initiatives at Allegheny County's Office of Children, Youth, and Families, the state's Young Child Wellness Coordinator for Project Launch, linking actions for unmet needs in children's health, and earlier, a senior advisor in the Office of Data Analysis, Research, and Evaluation at Allegheny County's Department of Human Services. She holds a BA from Yale University, a Master's of Science from the University of Oxford, and is pursuing a PhD in political science from Boston College. So thank you all both for joining us and certainly bringing your expertise to this space. And just to get us started, we always like to give the audience a chance to learn a little bit more about the mission and vision of your organization. So I'd like to start with Megha and share a little bit about what the overall mission of Monarch Foundation is.
Yeah, absolutely. Thank you for having me. I'm excited to be here and frankly to learn from Kim as well. But the Monarch Foundation, we're a small family foundation. We're based in New York City. And the work that we do is extremely grassroots. We like to support organizations that are on the ground, working directly with the communities that they serve. We have two main bodies of work. Half of our work is focused on early childhood and pregnancy, and the other half of our work is focused on climate, sustainability, and equitable access to green space. I'll pause there.
Thank you. Kim?
Hi. So thank you so much for having me today. I'm really excited about the conversation as well. And I'm excited also just to share with folks, what Footbridge for Families does. So we're a local nonprofit in Allegheny County that provides really one-of-a-kind rapid support and service coordination for individuals facing financial crises, which have no other solution. And if I may, I'd love to just explain kind of how it works, because I think once people understand our model, we'll be able to, questions might be a little bit better answered if I can just get that part out.
Sure.
So we basically partner with every type of agency and professional in our community who might be able to identify a family facing a crisis. So right now we have over 80 partners in Allegheny County, and that number continues to increase. They range. We have pediatricians, family physicians, school counselors, librarians, child welfare workers, behavioral health clinicians, really the whole gamut. Any professional who can verify that a family meets our eligibility criteria. And we harness these community-based referral partners basically to act as a two-way trust bridge between Footbridge and recipients. So our referral partners serve as kind of an organic means of identifying family and individual needs, but they also act as an authenticator of the appropriateness of our aid. So Footbridge, really, we cut red tape. We meet families where they are by working with community stakeholders. So our community stakeholders, we ask them only to bring us true financial emergencies that can be resolved through no other means, but with our aid will lead to meaningful change. So like on the child welfare side, this would mean we don't accept cases where maybe there's a really active substance abuse issue and we're just kicking the can down the road. But on this basis, we can really meet families where they are. So unlike most other programs, families don't need internet, a printer, scanner, paperwork, transportation. They just need to answer our call. And then the way we work is that our onboarded referral partners can quickly log on to our system, which is our website, tell us about a family situation. Our staff reach out always within 24 hours, but we can be as expeditious as necessary. As I'll share maybe a little later in this talk, I come from a child welfare background, and I really wanted, a child welfare worker who might be going in for an allegation of physical neglect to have the ability to kind of go in and resolve what the crisis might be if it was an economic crisis, rather than being forced to remove a child. So we've actually turned some child welfare cases around within 2-3 hours. Notably, all payments go directly to third-party vendors. Sometimes people ask that question. So we're paying, landlords, utility companies, car mechanics. And then basically our staff screen for additional needs and curate referral recommendations that are shared with the family and the referral partner. So that's kind of the kit and caboodle of how we work.
That's great. And we're going to stay with you for just a moment, Kim. And I'm curious to know, I know the genesis of Footbridge is really a dynamic story. And I would love for you to share with the audience the origin of Footbridge. What led you to launch the organization?
Sure. Really, issues that I was seeing while working at the Department of Human Services, particularly in child welfare. Footbridge kind of got its impetus after we won the 2020 BNY Mellon Up Prize. If there's any would-be entrepreneurs out there, I highly encourage you to look into this opportunity. It was wonderful. Back in 2020, I think there were over 200 different folks vying for the most innovative solution to a social problem. And I met the most amazing people, some of whom are now joining, the Footbridge board that I worked with there. But I made that move to pitch my idea because of the work that I had been doing as a senior child welfare administrator then, and just really seeing a problem that as I began to look around and read research nationally that I was seeing was a problem facing families across our country, which is basically, a relatively small, unexpected financial crisis can lead to exponentially worse outcomes. And I can share with you, I gave this hypothetical story when I was pitching at the Up Prize, but I think it really kind of like drives the point home. So I'll share it with you all today too. I'm just going to walk you through a sequence of events that just unfold for families all too often, and I don't think that people realize. So I'll call a mother hypothetically Sarah. Sarah had a job, but due to illness, I myself am a little ill here. Had lost some hours at work, fallen behind in rent, and was evicted. She found a new apartment where she could afford the monthly rent, but couldn't come up with the additional $700 for a first month's deposit. We do a lot of this work. So because she couldn't come up with this additional $700, which is, like the cost of a mattress, she and her children were forced to sleep in her car, her 2 children. And so because she was technically homeless, because she couldn't come up with the $700, child welfare was forced to remove her children and place them with a foster family. It will amount to $56,000 for 6 months. So $56,000 compared to $700. There are over 200 homes listed in Allegheny County for less than that, So I think this reality that we're forced to rely on our most expensive social safety net programs, which unfortunately can be quite traumatic for families because of relatively modest financial needs. This continues to propel, it did with the Up Prize, and I think it continues today, to propel interest in investing in our work. And as I'll share later on in our talk, we're really leaning into data collection and research to document the return on investment of our intervention.
That's very helpful. I think, Kim, it makes me think back to when we were doing the work sessions and we landed on developing, a draft of the stages of family need and the continuum of support that's really needed, right? And so I think we're going to talk a little bit later about scalability and really what, because a lot of times there's this question of when you're handing out cash, how is this sustainable? But I think that you bring up a great point in that example that it's the different stages of need. And I think this was something that was highlighted within the investment advisory councils, is that families have different entry points and different needs at different stages. And therefore we should be responsive to that in the way in which we set up our programs and our grant making. And I think that you illuminate that very well. Question for you. I would imagine that you mentioned that you have 80 different partners. How did you go about building a space for cross-sector and community collaboration in your work?
Well, I think that it certainly helped that I had worked at the Department of Human Services for around, 8-9 years. So I was very familiar with, the key stakeholders. My work in prevention helped me realize that particularly for the younger kiddos, it's often the medical community, pediatricians, obstetricians who have eyes on children, engagement with families before they enter school age. And so this kind of organically led me to reaching out to my contacts, and it's kind of been wildfire. I mean, we have the ability for those who are interested to reach out to us on our website, and we hold 2 different orientations a month. So it hasn't been difficult to find community partners. And I think really it's because we're a tool for them. We do have a programming in this country in terms of just federal means tested programs. We have a wonderful array of nonprofits, but everyone kind of does a little bit of that and a little bit of this, and there's still these gaps. And that's Footbridge, we fill in the gaps. So we're a really meaningful tool for referral partners. And I would say, particularly on the medical side, we've been working with UPMC for the last year now, and we began putting out a survey to the medical community prior to onboarding them as referral partners. And I'll just share because I think it's pretty interesting. One of the questions we asked, was, do you feel comfortable talking with your patients about their social needs? And I'll just share this fact in case folks don't know it, but 80% of health outcomes are related to social determinants of health, which is just the healthcare's version of saying issues related, to socioeconomic issues. 78% of the medical practitioners talked about how they were incredibly stressed by their inability to assist patients with their basic needs. And, we heard quotes like, it's stressful when a member has needs I can't meet. It damages our relationship. I feel I can't offer a resource. I feel that then they won't trust me. A lot of folks said, I just don't ask because it feels actually worse to ask and not have something to be able to offer. So being able to be this kind of, the Footbridge model works because we ensure that all of our referral partners exhaust everything else that could be used. So we prioritize filling in the gaps, but then there's no wrong door. We can fill in the gaps. We also ask those whom we help after we've helped them. We do a lot of evaluation work, what they feel about their referral partners. And 88% have reported that they feel better supported by the provider after having received a referral to Footbridge. So this just, goes beautifully from a public health perspective. And 92% have reported that it would increase their likelihood to keep appointments in the future, which, in terms of just thinking about sustainability, keeping well child visits is a HEDIS measure for health insurance plans. So that's an economic incentive for them, to support our work because we're helping them get their patients into these well child visits.
Yeah. I mean, it seems like this is a common theme, right, across all of the conversations that we've had so far, is that there's really no way to separate out all of the different issues around what happens for a family, right, in terms of the socioeconomic status of a family has so many implications for access and what really they have in terms of healthcare, education. And we know this, right? But we think about, okay, then what is the truly community focused and centered solution? And I really just appreciate how you're thinking so thoughtfully about that. And I'd love to talk with Megha and just tell us more about what the foundations of the Monarch Foundation really are, and how are you all thinking about what it means to have community-centered and community responsive philanthropic structure in your organization?
Yeah, absolutely. And I think some of it goes into the background of the foundation as well. And I did it briefly, but I'm happy to share a little bit more too, in that we're a relatively new foundation. And so we started our work in 2020, and the principles behind the foundation, they have been philanthropic for quite some time and always have been. But I think with the pandemic in particular, and seeing the impact that it had on New York City in particular as well, it was just this moment of realization for them where they recognized, as folks that had assets and had wealth and had opportunity, they were able to manage through the pandemic in a very different way than their neighbors. If you looked 100 blocks north, the situation was so different than how they were managing and how their neighbors were managing and how their friends were managing. And I think that was a moment of realization where they recognized, we can be more meaningful with our philanthropy, and we can be more strategic with our philanthropy and how we think about dispersing funds and how we think about allocating resources. But we just don't have the capacity to do that. And so they both work full time. And that was a moment of, either we invest in this or we don't. And that's when they brought me on board to help them through the process of setting up the foundation, recognizing, this is how you can think about right sizing your investments, and what are the issue areas that we really want to tackle. What was interesting though, is that meant that we were setting up our grant making portfolios in the midst of a period of a lot of change for the grantees that we were hoping to serve, and the grantees that were then hoping to serve their communities. And so what it meant was that I think even embedded into the work that we started doing right off the bat is we had to be responsive. We had to listen. We knew nothing, frankly, and they knew everything. And so the power dynamic shifted. The power is not in our hands, and we didn't want it to be in our hands. We wanted to put that power into our grantees' hands, into the community's hands, to say, this is what we're dealing with in this moment in time, and this is the solution we need. Can you help us get there? And I think that being a foundational part of how we started our work, how we started our grant making, how we started our investments, ended up just staying. And I think we've recognized that sometimes, I mean, the safety nets that we have in place, the social services that we have in place don't take that stance. And I think there's reasons why that happens, and there's reasons why it needs to be that way, but there's a lot of reasons why it doesn't need to be that way. And so we really hope to just kind of set that model of how can we be community first, how can we be responsive, how can we listen, how can we be hands open. And what that ultimately means is we've since built out 2 grant-making portfolios. We've built out an investment portfolio, and then we have the Bridge Project, which is a special project, which we'll talk about later in this talk, against our early childhood work. But embedded across all of that is trust, trust in communities, trusting people to know what they need, and then saying, you know, let us work together to get you there. But ultimately, I'm not the person that knows what you need in this moment in time. And I think it alludes a little bit to what Kim was saying earlier of, a family might just need $700, but what we think they need is this $56,000 solution. And that creates a lot of waste, and that creates a lot of extra where we don't actually need that. And so there are ways to kind of think around that. And I think for us, it's always been, how can we talk to folks before we do anything? How can we always provide unrestricted funds when we can? How can we always think about multi-year grants when we can? And how can we also always think about a feedback loop? So as much as we want to hear from organizations what they've been able to do with our funds, we want to hear from them how we as an organization can be more responsive, more helpful, provide support where necessary, and not provide extra voices where they don't need it. And I think it's pretty pivotal to all of the work that we do.
Absolutely. And so a lot of times in the philanthropic space, we hear a lot about, like, is this sustainable, right? Is this scalable? How does scalability lead your organizational focus?
Yeah, it's a good question, because I mentioned and I led with the point that proximity is important to us, and it's important for us to be investing in organizations and people who are serving folks on the ground. But it's tough to scale something like that. And that's why you see solutions that our government has, which has a certain amount of waste, because you can't be proximate and scale at the exact same time. And there are trade-offs between those two kind of notions. The other decision that our principals came upon in 2020 at the inception of the foundation is that they wanted to scale down all of their wealth. So they wanted to give away all of their money in their lifetime. And I think that posed a tricky question of scale in our minds, because the types of organizations that we want to support, I guess dumping massive amounts of funds on them in one single year could effectively be overwhelming. It could kill an organization. It could not allow them to actually approach the work in the way that they want to. And so we did have this balance of, how can we stay proximate? How can we support grassroots organizations who might have $1 million annual operating budgets, but at the same time, we're trying to scale down massive amounts of wealth. And this is really where the Bridge Project came in, where we said we are going to have to decide across our portfolios how to think about proximity and how to think about scalability, knowing that not all of our portfolios will have both. And so where we ended up landing is that our grant-making portfolios to us have always been proximate. We issue really small grant sizes, but we are consistent with them and we grow with an organization over time. We're not necessarily deploying 10, 20, $30 million through our portfolios, but the way that we're deploying the cash is really catalytic for smaller organizations. And so that's been really important to us. On the climate side, we built out an investment portfolio, and in our minds, that is where the scale comes into play. So we're actually thinking about investing in massive technological advancements that could help climate solutions, but it's different than giving a grant to an Indigenous organization that's working with water in Alaska. Those two things are very different, but they both approach climate in ways that are ultimately, in our minds, successful. On the early childhood side, we have our proximate grant-making portfolio, and we kind of landed on the Bridge Project as the way to think about scale. And this is, we'll talk about it in a little bit, I know, but a little bit of what it does is that it just provides unconditional cash to mothers. And so what that means is the overhead on doing that, serving 100 mothers versus 500 versus 10,000 is not really a lot. And so you can think about scaling in that way. If you give people unconditional cash, it's a lot of money. Like, I am totally cognizant of that, but it's also not a silver bullet, which is why we need to have the proximity angle of, oh, well, here's cash, but how do you actually think about accessing services? How do you think about involving your community? How do you uplift an entire neighborhood? That can't be done with just cash. So we kind of think about them as discrete, but involved.
Thank you. That's helpful. So Kim, I know you've also given a lot of thought to scalability and advancing the work of Footbridge. Do you mind sharing a little bit about the vision you have to achieve scale, and how you mentioned it a little earlier, the data and evidence of evaluation that's helping to support your organization's reach and expansion?
Sure, absolutely. I mean, the issue that Footbridge addresses, these gaps in our safety net, it's impacting individuals and families, senior citizens across the country. And our model really is agnostic to geography. So I absolutely, it might take me some time, but I would love for Footbridge to become a national nonprofit in this space. Since we started in the fall of 2020, we've helped over 400 families avoid the consequences of eviction, utility shutoffs, loss of a job if transportation couldn't be resolved, medical appointments and services. And we are leaning heavily into data. So we are starting to code, what are the escalations that we prevent? Oftentimes, we have to probe a little bit more, and then the mother discloses, well, sure, I'm also actually only eating one meal a day, so we know food insecurity is there. Domestic violence situations, we've had a few of those whom we've helped, self-disclose. I think I likely would have died if you hadn't been able to step in. I don't know how you put a price tag on that, but that's something to note. And I think that there's enough research about how much these things cost. Again, how do we put the cost of a value of a life? But something like the homeless system, we know how much that costs. We know how much the child welfare system costs. And so actually right even now we have Carnegie Mellon master's students, 6 of them doing their capstone project, scouring the research. What is this return on investment that we're seeing when we can prevent these escalations from moving forward, right? Everything from, the individualized costs of people having to take out payday loans, in order to try and patch things together, to then the societal costs. We know the intergenerational impacts of what we're doing are probably very significant. Caregiver stress. I have a background in early childhood mental health. You could be the most wonderful parent, and I have 3 kids. And so I think about this often myself. When you are a stressed out caregiver, that carries over and it impacts children's mental health. So, we might not necessarily see it, but I would wonder, how are we even preventing potential needs for, special ed, if we can help a family not have to enter the homeless system and remove some of that trauma that children might otherwise have to face. We also, I'm partnering on the healthcare side, are looking at HEDIS measures, like, are families, attending their well child visits now? Are they following through on some of the things that health insurance plans care about? Are they using the emergency room less for, chronic diseases like diabetes and asthma? We're leaning heavily into the evaluations that we do. So we reach out to families at 1 month, 3 months, and at 6 months, because we want to see how long is the duration of our impact. We're also looking to integrate our data with the Allegheny County Department's data warehouse, which is just amazing. I feel so fortunate to have been able to work in DARE earlier on in my career, just to realize the power that this data can have. So we'll actually be able to see longitudinally, we maybe hear from a family 1 month, 3 months, 6 months, we prevented them from being evicted. They still say that, but then we can look out, 2 years later, did they end up entering the homeless system? Did they end up entering the child welfare system? Looking at a control group, did the people who we help maybe not have to reach out to the Resolve Mental Health Crisis Hotline? Because we know when you're in a financial crisis, it's also a mental health crisis, right? So, how many mental health crises are we preventing by being able to engage? So, I think that we will potentially have the opportunity to continue to grow and expand so long as we can show people the numbers. People want to see the numbers, and I'm fine with that. I want to see the numbers too. And as a young organization, we're continually iterating. So these 1 month, 3 month, and 6 month evaluations are not just, to hopefully prove out the success of what we're doing, but for our team to also learn. It's very important to us because sustainability, one of the pushbacks I get, especially when I first started this, was, well, this is a Band-Aid and the need's going to be much too great. And so I really try to say, we're focusing where we're going to make a difference. It truly is a financial emergency that if we didn't resolve it, you're going to be looking at hundreds of thousands of dollars otherwise. So this makes sense. Two, everything else has been used. If LIHEAP's active and you qualify for LIHEAP, there's a winter moratorium on shutting off heat. We're going to have you go that route. They're supposed to respond in 48 hours. If they don't, we'll tell you the advocates to call to make sure that they do. So we're not just willy-nilly, giving out money. We're always the funder of last resort. And then, we are focused on, and Robin, this goes to the work that we had done with the council. There's kind of this bandwidth, this threshold of families who are struggling to have savings to make ends meet. Footbridge doesn't have any income eligibility. In fact, during the pandemic, there were a lot of domestic violence cases that would, surprise you. Actually, if those of you on this Zoom are in the human services field, it doesn't surprise you that that type of situation knows no economic bounds. But we basically are wanting to prevent families from slipping, so that people can continue on that trajectory of hopefully continuing to better their household and then hopefully that, the next generation's well-being.
Yeah, that situational poverty was a conversation that we had a lot during those conversations, and how something like what your organization provides to families can really keep them on track to the true definition of economic security for their household. So I'm curious to know from you, because I think always we're thinking about the advocacy piece of this and the policies. Are there policies that you're focused on that you think are necessary to address, to really advance programs like yours that provide family cash support?
Yeah, I thought about this question a lot. Full disclosure, we had the opportunity to think about these questions in advance, which I appreciated. And I think in terms of policies to help promote our work, I think that it's, the fragmented nature of our welfare state just makes it challenging to do prevention work. So I shared that I feel fairly confident that we are helping short circuit intergenerational trauma, that we're promoting child mental health, and perhaps, reducing the need for special ed, right? But we will never, ever see any funding from that system for the benefits of our work. So when you do prevention work, you are saving money across various systems, but you have to find the one funder. And sometimes it's difficult to find the one funder who will say, well, maybe not all of the costs accrue to us, they accrue to others as well, but we'll be the ones to foot the bill. And I think health insurance plans, they face the reality that they can't guarantee today's clients are going to be tomorrow's, and this impacts their business case for investing in prevention. So I'm not sure we're necessarily going to be able to change those policies. But Footbridge is very interested in policy change that will make the need for our support less necessary. Someone once told me that all good nonprofits try to put themselves out of business, and I believe in that. I take that seriously, and I think there's a great deal, on that front that could be done. Updating our federal policy thresholds that are used to determine eligibility for things like WIC and SNAP, LIHEAP, CHIP, homeless assistance programs. These current guidelines are based on the 1955 assumption that food constitutes a third of a family's budget. And we know today that housing and childcare are the biggest expenses that families face, with food at about 14% of a survival budget. So, many people who could truly need help simply don't qualify for social supports because of these antiquated modes of trying to see who might benefit. And I think I just want to introduce this idea, since we're talking about family economic stability. In 2009, United Ways began to calculate ALICE measurements. I'm not sure if the folks on this call are familiar with that, but it stands for Asset Limited income constrained and employed. And as opposed to the federal poverty thresholds, which are the same for all 48 states, these ALICE thresholds are different for each state, and they actually look at the actual cost of living. So, looking at Pennsylvania, I looked up the number before this call. It's $69,648 for a family of 4 in 2018. And the federal poverty level is $25,000 for a family of 4. So, we're a bit outdated with how we think about what families need to actually just survive. And these are survival thresholds. And alarmingly, the number of ALICE thresholds is increasing in Pennsylvania. The ALICE threshold rose from 21% in 2007 to 27% in 2018. Meanwhile, the poverty level remained at 13%. So I think it's just important to also, be looking at the right data. I think our policymakers really need to consider that. There was a 2021 survey done, and they found that 68% of the asset limited, income constrained employed households had 1 month or less of savings. And these Pennsylvania stats, this is being done across the country. About half of the country's United Ways are doing this type of research. These trend with national statistics. And this is why I feel like Footbridge is needed. We have a large number of people and families and individuals in this country who just don't have the supports that they need. And if they face a crisis, are going to end up falling until they hit the most expensive systems. I'll give the floor, but I just want to put a little lobby out there that I'm really devoted to leaning into the research and the policy discussions about these things. So if anyone on this call is interested, subscribe to our newsletter. We're going to put it out monthly, and I'm going to hopefully be, putting some of the things that we see in our work in a larger context of some of the policy conversations.
That's great. So Meg, I want to jump to you and learn a little more about the Bridge project that you have been mentioning on the call. And the entire approach is providing direct cash to new moms in their first days of parenting. Can you share a little bit more about the concept and the structure, and even some lessons that you're learning from the work that you're doing?
Yeah, absolutely. So far, I guess I've talked quite a bit about the Monarch Foundation and our approach to grant making as a funder. The Bridge Project is where we really operate. We're operators at the end of the day. The Monarch Foundation has to date funded a good portion of the Bridge Project, but we now bring in additional private funding, public funding for the program. And so it's really about how do you operate as a nonprofit. And Kim, I love what you said, because this is completely how we operate as well around, a good nonprofit should want to not exist in however many years. And that is completely our approach to it. And it's interesting because I've never heard anyone else say that before. So I loved hearing you say that, because it's totally what we think and what we say. And people are shocked when I say that, but I think it applies to foundations as well. A good foundation will not exist in 10 years. And that's because they've actually deployed their capital, and they've done it thoughtfully, and there isn't a lot of red tape. And I think the same thing exists for nonprofits. But backing up a little bit, so where the Bridge Project actually came from, I think it comes from the idea of scalability, which we were talking about before. I think we recognize with our grant making portfolios, we weren't going to be able to scale capital in the way that we wanted to while staying proximate. And while we were chatting with grantees over the course of 2020, I think we came upon this realization that nonprofit organizations on the ground that are providing services, providing holistic programming, just weren't able to meet families where they were at that point in time. And I think that was because A, they couldn't physically be there, and B, the needs shifted. You no longer needed a mommy and me class to help you think about how to nurture your baby. You needed money so that your baby had diapers. And your partner had lost his job because it was an in-person work, blue-collar job, and now you didn't have access to income. And what we saw was a lot of our grantees actually shift from providing services and programming to providing emergency cash. So rather than putting their resources towards actually building out the programs, they just gave people money because it was the fastest thing to do in that moment in time. And you saw that reflected on the public stage as well. You saw the federal government kind of kick off these emergency relief checks. There was talk around the child tax credit at that point in time, what it could mean to actually give people unconditional cash per child to actually allow for additional stability. It hadn't started yet, but there was talk around it. And that just caused us to pause. It caused us to think and say, you know, we think of cash in this country as an emergency intervention. And that's completely fair, and that should be used like that. But the families that we serve on a day-to-day basis and the families we want to uplift out of poverty are living in emergency situations every single day. Even to lean back on the ALICE metrics that were talked about, the self-sufficiency standard is very similar in that it tries to kind of put into perspective what it actually means to barely survive in a certain region. In New York City, for example, for a family of 4 compared to around the $70,000 for Pennsylvania, it's $105,000 to barely survive for a family of 4. You're talking about six figures. Like, we're lucky if we hit 6 figures. The families that we serve have 0 income. They're living on unemployment. The family we serve are living under the federal poverty line, which is $25,000. So they're making just a fourth of what they actually need to survive. That's choosing one family member to survive and the other 3 do not. That's essentially what that is. And so these families, they're living in emergency situations. And so a huge question in our mind became, I mean, poverty by definition is a lack of cash. So what if we gave people cash? That's what they're lacking. And it's not a silver bullet. It's not going to solve everything, but it stabilizes people and it allows people to rise to think about second order implications. So it's not, how do I get dinner on the table tonight? It's not, how do I get to my job because I can't afford the subway and I can't afford to get my car fixed because I ran into this unexpected emergency. But it's actually, how can I think about next week? How can I think about putting a little bit aside for savings because my baby's going to need that when he or she goes to school? And so it's actually helping people think about hopes and dreams rather than surviving. It's thinking about thriving. And so at that point in time, we were just funders. And the question became, who's doing this? How can we fund someone who's doing this? This was the end of 2020. And we did one of the most robust searches I've ever done. And there was nothing. Nobody was doing this. Nobody was focusing on families. Nobody was focusing on early interventions, particularly at a period of time when, frankly, you're going through a lot of change and you have a lot of unexpected expenses and you think you can plan for the birth of a child, but frankly, you can't. And that's regardless of how rich or how poor you are. There are unexpected instances that happen when you're in pregnancy and postnatally. It's just kind of what it is. And so the question for us as funders then became, do we believe in this enough to do it ourselves? Do we actually believe in the power of cash enough to spin out a program and actually launch it? And the answer was yes. So 6 months later, the Bridge Project is what kind of came from that. To your point earlier, it's a direct cash assistance program at its core. That's what we do. We provide mothers with unconditional cash on a biweekly basis for 3 years. The hope is to cover from the 3rd trimester on up to around 3 years of life. The main reason why we chose that is the mounds of research that exist around the importance of the first 1,000 days, of really recognizing that if you don't get it right in the first 1,000 days, it is coming at a cost to society, and it is coming at a cost to that family and to that child in terms of what they can achieve. But if you look at our public systems, we only start supporting at age 3. That's where 3K starts. That's where Head Start starts. That's where you're actually providing public assistance. And we don't actually look earlier than that. But if we don't look earlier than that, we've already lost the battle. And comparatively to other countries, I mean, the United States really lags in terms of its support in early childhood. I think there was an article I read a little bit earlier. If I find it, I can surface it and quote it more accurately. But the United States is equivalent to Turkey in its supports of early childhood, whereas our economic status is equivalent to the Western country powerhouses that actually do support in early childhood, and we just don't do that. And so the program launched in the summer of 2021. We had 100 mothers join the program. We set up the program as an RCT, a randomized control trial. And the main reason for doing that was to actually prove out what we thought was true. We are also very, I think, We value learning quite a bit, and we value knowing whether what we're doing is right or not right. And there was not much research. There was research that existed at that point in time saying that there was efficacy for these types of programs, but there wasn't concrete evidence specifically for the population that we were looking at, specifically at the location, specifically around duration and amounts and time and all of those questions. And so for us, it was important to invest in that alongside with our investment in mothers. At the end of the day, if the worst thing we do is give a bunch of mothers $1,000, I'm still happy. But I would love to be able to say, you know, it led to increased stability. It led to decreases in child poverty. It led to increased mental health. It allowed mothers to stay at home a tiny bit longer to invest in their family. And so that's kind of how we launched the program. And one of the big questions was, what is the right dollar amount? Is it $200 a month? Is it $500? Is it $1,000? I don't know. And what does that look like with this shifted cost of living? We're not living in the 50s anymore. And the structure and dynamics of economics in a household has shifted. And so what is the right dollar amount? Particularly because childcare is a new expense for all of the families. And it is a massive expense to what Kim was saying earlier and to some of the comments in the chat box. And so half of the mothers in the program received $500 a month and half of them received $1,000 a month. And then we had an additional control group that was receiving no cash, but was participating in research. The program kicked off, and what we started to see was actually $500 was not enough every single month to actually achieve family stability. So one of the questions that is generally asked as one indicator of financial stability is how ready are you to actually deal with a $400 emergency unexpected financial situation? When we started the program, over 60% of our mothers had less than $50 in their savings account. And so what that meant was it was cash under their pillow in an emergency situation to take a cab to a hospital, or to get that last box of food or that last box of diapers, or to make sure that you had enough formula for a week or something, but it was not sustainable. And what we saw even in the first 6 months of the program was of the 500 or of the 50 mothers that were receiving $500 a month, it kind of flatlined. They were still able to, you know, have the $50, but that was it. It allowed for taking care of day-to-day expenses that they otherwise weren't able to afford, but it didn't allow for savings. It didn't allow for financial stability sustainably. What we saw in the $1,000 group was actually families thriving. Over 200% increase in the ability to plan for an unexpected emergency. And that was just after 6 months. So what we started to recognize was the dollar amount really is $1,000. Like, that's truly what you need, because you're not just operating on today, you're operating on taking care of everything that happened yesterday as well, that you weren't able to afford, that you are now in debt from, and you now have to actually solve for, and you have to make decisions. Is it food on the table today, or is it a diaper for my baby? And our moms were choosing a diaper for my baby, and I will not have dinner. Like, that was the types of decisions that were being made. And so $500 allowed them to not have to make that type of decision. But did it allow them to get out of subsidized housing and actually have an apartment, a 1-bedroom apartment for your family of 4? No. And so we started to see that with the $1,000 group. The other thing that we've started to see quite a bit is the impact on mental health, on depression, on anxiety, particularly postpartum. We know that it's a huge issue, again, for any economic class, for any social class, for any racial class, but it is especially true for Black and Brown mothers. And I think a lot of that, 100% of the mothers in our program are Black and Brown. And I will also say the median average household income when entering the program was $14,000 annually. And so comparing that to the $105,000 that you actually need to survive, we're really talking about deep, deep poverty in New York. Though, if you look at the federal poverty limit, you're really talking about maybe 200%, right? So it doesn't seem deep if you use those types of numbers, but if you use Alice and you use self-sufficiency, you're actually able to understand what that means. And so what mothers actually tell us on a day-to-day basis, it's reflected in the numbers, it's reflected in the stories, and in our qualitative interviews, our focus groups, is that more than anything, this cash provides them with room to breathe, room to think, room to show up in the way that they know how, because they are trusted, frankly. I'm just handing you money and I'm saying there's no strings attached. You can spend it on whatever you want, but I trust you to know what's best for your family. And I think the really sad, tragic heartbreak of it all is that we don't do that as a country. We're very paternalistic in our solutions. We say, you know, this is how I survived and this is how I thrive. And as a result, this is how you should thrive. And it comes back to those $56,000 solutions when it could be $700 if you just trusted someone to say, this is the issue I'm dealing with right now. And so it's been really interesting to see that. We see flexibility of use with the cash. So we do also, I will say, like, we track spending data to be able to understand where is money going in the aggregate. So we don't look at individual spending data, but we say as a group, what did mothers spend the money on this month? Less than 0.01% goes towards vices. So things like drugs, alcohol, that type of thing. Though what I will say is if a mother needs a glass of wine at the end of the day, like, I can understand that, because there are days where I need a glass of wine at the end of the day. Now, I want to go to the liquor store and buy a bottle of wine. I am allowed to do that. But for some reason, these mothers are not. And so I think a lot of the work that we're trying to do with our research is just collecting data that hits against some of these harmful narratives that we have prescribed to folks living in poverty just because of their situation, not because who they are or how they show up as parents or how they show up as a part of this society. And so what we're actually seeing is that mothers are thriving. They're really able to show up. They know how to parent. They know how to take care of their babies. They know that it would be helpful to have 6 months maternity or 6 weeks maternity leave to take care of their baby, find safe childcare and affordable childcare and accessible childcare that works for their work schedules, that then allows them to re-enter the workforce in a more productive way, rather than being forced right back into it 1 week after giving birth, which has happened to quite a few of our mothers. I know of at least 4 of our mothers who went back to work the day after giving birth because they could not afford to stay home and they could not support their families. So that's kind of some of the learnings that we've gotten since then. We've added an additional 500 mothers into our program. So we now have 600 mothers as of this past summer. The goal for us is that we have shifted away from calling ourselves a pilot program. This is not a pilot anymore. We have data that this works. And the child tax credit, honestly, was a way to really prove that. It was a nationwide experiment, and it had a built-in control group because there were people that weren't receiving the funds. Then those exact same people started receiving the funds, and then they again stopped receiving the funds. And what you saw is the first month after receiving an influx of just $300 per child, you saw 3 million children lifted out of poverty. And what you saw at the end of those payments in December is 4 million children were actually pushed back into poverty, and you saw child poverty spike by 41%. Wow. I personally don't need any more data than that. We are still conducting research. Our RCT is still underway. We have in-house research as well. But if that's the number that I'm looking at with $300 across our nation, imagine what $1,000 can do. And so that's kind of where the program's at right now. It's shifted, and now we are just spinning out more cohorts of mothers. We are just adding more folks into the program. Last year, we spun out the Bridge Project as a standalone project from the Monarch Foundation. So it's no longer housed under the foundation. It's its own public charity, 501c3. And that means that we bring in additional funds as well to help support. So anytime a funder gives us money, it's immediately dispersed and more mothers are added into our program. All of the overhead, all of the operations is covered by the Monarch Foundation into perpetuity. And now it's just a question of how do we get our nation to notice? How do we get an expanded child tax credit as the permanence? So that's
I do have a question. You may not be quite ready for this. This is a random one, but just you shared so much in this last several minutes here, and it's making me think. So if I understood you correctly, some of the moms have been in the program since 2020. So now we're in 2023. Their children are going to hit 3 years old soon. And I would imagine that's when, that 1,000 days ends. So what is the plan for transition for families that have been in this program? Because it sounds like, the funding that you've provided consistently has really been significant for their households. And then at 1,000 days, that plug is pulled. So what is the plan, and how does that look for Monarch and the Bridge?
Yeah, it's a really good question. And I think offboarding is something that every program has to think about. But when you have this consistent of a program, you definitely have to think about. And so the earliest cohort was launched in 2021. So we have 1 extra year, which is great. But we are thinking very seriously about offboarding. I think one thing that's foundational to how we're thinking about it, though, is that if we can trust a mother unconditionally to give her $1,000 a month, no strings attached, let her do what she wants to do with it, know that she would put it towards her highest need. We also have to trust that once that money is taken away, and she knows it's going to be taken away and she's not going to have it forever, she will know how to adapt her family as well. And she has been planning for that. And so a big part of this program is being able to just be as transparent with folks as possible, saying you have 3 years of support and then you will not have the support. People know how to manage that. If somebody told me that, I would just sit down and I would budget differently. I would save here on this thing, knowing that I might need it down the line. And our mothers do the exact same thing. So ultimately, I'm not super stressed in that way. That being said, I think there's a lot of opportunity for solid handoff such that we can set people up to be in situations that allow them to continue to thrive. And so what that means for us is our babies are going to be hitting around age 3, and transitioning them into government structures that already exist at age 3 is really important to us. So it's really sitting down and helping folks think about Head Start, about pre-K, about what it means to transition into educational attainment, and actually thinking of that as the pathway to success. And so we are planning to at year 2, so this summer, sit down with all of the 100 mothers that joined us in the 2021 cohort and actually help them through the application process, which launches in January and February for the upcoming school year. And so it's handing off in that way. The other thing is that the city of New York, and this is specific to New York, so cognizant this doesn't look the same in other regions, but the city of New York has also said for every kindergartner, they are going to be setting up a child savings account funded with $100. And so, but you have to know about it, of course, and you have to know how to apply for it. And so the other thing is making sure that mothers know about that opportunity and are able to access that opportunity as their children start to enter education and pre-K, knowing that they have 1 year out from when they should be applying for that as well. The last thing I'll note is that from the research, I mentioned that we learned that $1,000 is kind of that stable level that really allows you to think about tomorrow rather than just today. We did shift the way that our program is designed and the amount of money that we provide to all future cohorts as a result of those findings. And so every mother in our 500 cohort and in the cohorts that we launched this year and onwards, everyone is receiving $1,000 a month for the first 18 months of the program. So through your third trimester and through the first 15 months of your baby's life, you're receiving $1,000 a month. For the latter 18 months of the program, everyone is scaled down to $500 a month. And so what we're starting to do is create the opportunity for less, less reliance on the Bridge Project money and create tiers. The hope is that if we were to ever get an expanded child tax credit, that would create a third tier, a tier down from our 500 to the 300. So once you hit age 3, you can then still consistently expect from the government a $300, but it's different than the 500. It's different than the 1,000, but it's all based on the fact that there are crucial inflection periods and points where finances are more important than others. So that's how we're thinking about that. I also saw a quick question just in the chat around referral to transitioning agencies. And the answer is yes. So the money is completely unconditional, but we do light case management with every single mother that comes into the program. And so what that means is we have a sense of her situation. We know where she needs support and where she doesn't. And as a result, we can refer them to any agency that's able to support them. So we also have built out a pretty extensive partner network of 40 plus programs and agencies. And it really spans from massive hospital networks all the way to on-the-ground doulas that support one-on-one and birth. And it really spans from early childhood interventions all the way to financial empowerment agencies, to tax and immigration centers, to housing support, to actually connect folks with the things that the that cash does not help with, frankly, because it's not a silver bullet and we can't do it alone. And all of the agencies that are doing that work on the ground are extremely important. And that's where we connect a lot of our mothers to the grantees on the Monarch Foundation side as well.
Yeah. Thank you, Megan, for that. I mean, you're so much information here. I think we've only got a few minutes left, but I do have just one additional question in terms of something that I've heard a lot, and a lot of the national work around guaranteed basic income is just doing it responsibly in a way. And I think you touched on that slightly, but I'm curious to know, so the families that are going to be applying for Head Start, for example, there's income requirements for that, right? So how are you all supporting families navigating through that? Because it sometimes will kick families out of eligibility at different tiers. And there's always been some concern that people would even lose public benefits if they do get cash assistance. So what's been your approach in like the very short period of time we have left?
It's a really big question, so I'll try to keep it concise. I think it's always been our number one concern because our benefit system and our social safety net is not built for interaction of influx of cash. And so what that means is any income you get, whether it's a gift or it's considered income, does impact your benefits and it does impact your eligibility for other programs. And that has always been our number one concern of we don't want any family to go through harm as a result of our program. You want to make sure that they're net benefiting. And so we've actually set up a very extensive process and benefits counseling session early in the onboarding process. We partnered with the Federal Reserve Bank of Atlanta to build out a benefits cliff calculator. It basically allows you to input any household situation. Say, you know, they're expecting an influx of $12,000 annually this year. And what could that mean to their benefits? So currently you're receiving $500 in SNAP. Does that pull it down to $300? Or does it stay constant based on the family, based on what they're expecting will happen that year? And we use that to kind of elucidate and say, you know, these are potential losses that you may actually have to deal with as a result of joining this program. The guarantee for us is that if we ever see a loss that is so great that it outweighs the benefit of the Bridge project, we recommend families do not join the program. That has only happened once from our 600 mothers, but then the decision is up to them. Again, they know their situation better than I do. If you want to take the $1,000 from the Bridge project and that is more helpful to you than the SNAP that you're receiving and you're okay with that loss, do it. Let's join our program. Let's do it together. And if you say, you know, I don't want to have to deal with recertifying for SNAP and going through the whole process and recognizing that that is in and of itself a difficulty, then by all means, it's your decision. The autonomy is with you. The decision's in your hands. You know what's best for your family. We've had 8 families drop out as a result of that, but everyone else has chosen to stay. So it's just not the way that our system is set up. But I think ultimately, if this is a policy solution, the system will be set up in a way that it doesn't allow for negative impacts.
That's helpful. Thank you. So in our last moment here, Kim and Mega, question for you always. We try to bring it back to something fun. What's one thing that's bringing you joy in your life right now?
Kim, go for it.
Well, I have 3 kiddos who are now 8, 10, and 12. And I probably say this at every juncture, but I feel like they're just at the epitome of cuteness and enjoyment in terms of their, their company. So I would say being able to spend time with my husband and 3 kids is definitely what brings me joy.
I love that. Mega?
Too. I will say we're at a really special period right now with the Bridge project where our babies are starting to talk. And I think what gives me joy is just spending time with them, being able to play with them, hear about things that are exciting to them and that aren't, being able to see the mothers react to what their kids are saying, the types of music they choose, the toys they pick out, how they actually interact with people who aren't their family. I think honestly, every time I play with one of our Bridge project babies, I cry. So maybe it makes me sad, but it's really just tears of joy to see, I don't know, how healthy and happily they've developed and the role that we've been able to play in that. I think it's the best part of my week.
Great. And if we have participants still on the line with us, we do have a survey that we would love for you to complete. So if you've got your phone, you can check out the QR code and give us feedback on this programming, as we're always trying to improve it. And as a reminder, we do have an upcoming in-person workshop on early relational health and the community mapping tool. So we hope that you will join us on February 22nd in Pittsburgh. And thank you to our speakers for your time today. And we look forward to continuing to learn more about this approach and what it really means to secure households in our region. So thank you so much.
Thank you, everyone.
Thank you.